Hello, friends. Welcome to the Medic World Study with Dr. Mahi. Today, we will discuss previous year questions of orthopedics INICET 2017. So, the first question is: a 5-year-old boy fell on his outstretched hand. X-ray is shown below. Which of the following vessels is most commonly affected? Options are radial artery, brachial artery, ulnar artery, and cubital vein. So, first of all, we have to identify the X-ray. Here we can see this is the humerus. Here is radius and ulna. So the fracture is there in the humerus and above the condyles. So it is the supracondylar fracture of humerus. And we all know the most commonly affected vessel in supracondylar fracture of humerus is brachial artery. Let's discuss other complications of supracondylar fracture of humerus. So, the other delayed complications are malunion, which results in cubitus varus or gunstock deformity, Volkmann's ischemic contracture, and myositis ossificans. So, the next question is true about Galeazzi fracture dislocation. So, we have to understand what is Galeazzi fracture. Galeazzi fracture consists of fracture of radial shaft with dislocation of distal radio-ulnar joint plus tear of triangular fibrocartilage complex. Tear of triangular fibrocartilage complex. Okay, so let's see the options. The first option is radial collateral ligament tear. We all know that triangular fibrocartilage complex consists of ulnar collateral ligament, not radial collateral ligament. So it is not the answer. Okay. The next question is interosseous membrane tear with ulnar shaft fracture. It's also not the answer because there is radial shaft fracture in the Galeazzi fracture. Now, the third option is interosseous membrane tear with TFCC tear and radial shaft fracture. This may be the answer. So, let's check the last option. Interosseous membrane tear with triangular fibrocartilage complex tear with ulnar shaft fracture. So it's also not the answer. So the right answer to this question is option C. Now the next question is a 25-year-old male presented to the emergency department with pain and swelling of the right knee. The radiograph of the showed the following finding. What is the best treatment for the given condition? First of all, we have to identify the condition. So, this is the patellar fracture, dislocated patellar fracture. So, the answer to this question is tension band wiring with K wires. Okay, we manage this type of fracture means displaced patellar fracture is managed by tension band wiring with K wires. Now let's move towards other question. Which of the following movements is being tested in the picture given below? Here is the picture. This one is the picture. We can see here the leg is moving this way, but the hip joint is moving this way. Means there is external rotation of the hip joint. So the answer to this question is external rotation of the hip joint. Now let's move towards the other question, which is the classification system used for the fracture shown in the X-ray given below. So this is the X-ray given, which shows the fracture of proximal humerus. So, the classification system used for proximal humerus fracture is Neil's classification. So the answer to this question is option C, that is need classification. So the next question is an elderly male presented with the history of fall on outstretched hand, following which he developed swelling of the wrist. Okay, his X-ray is shown below. What is your diagnosis? Here we can see in the X-ray that there is the fracture of the scaphoid bone on this side. So it is the answer to this question, that is fracture scaphoid. Now the next question is Gustello-Anderson classification type 3B. So to answer this question, we have to understand the Gustello-Anderson classification. So let's see an overview of this classification, then we will come to this question. According to the Gustello-Anderson classification, open fractures can be classified as type 1, 2, 3A, 3B, and 3C. So, first of all, discuss the lengths of each wound. Type 1 is the simplest one, that is the puncture wound less than 1 centimeters. Type 2 is the lacerated wound which is more than 1 centimeters and less than 10 centimeters. And type 3 are all the more than 10 centimeters lacerated wounds. Now, other characteristics of these types. Type 1 is the simplest one with minimal contamination and minimal soft tissue damage. In type 1, we have to learn only the length and nothing else. Okay? Everything is minimal. And in type 2, there is moderate soft tissue damage, bone cover is adequate, and minimal comminution. Okay, now type 3. Type 3 is slightly complicated one. It's not so tough. Let's study one by one. Type 3A, 3B, and 3C. We will study it with the help of buzzwords. In type 3A, we have to see this line. Extensive soft tissue damage. Rest all the things are coverage is adequate. Segmental and severely comminuted fracture, heavily contaminated wound. All these things are present in type 3B too. But in type 3B, we have periosteal stripping and bone exposure. In type 3C, there is any open fracture with vascular injury requiring repair. So these are the buzzwords. We all have understood the Gustello-Anderson classification. So the answer to this question, let's discuss. Let's see the options one by one. First is open fracture, wound more than 1 centimeters. Okay, but less than 10 centimeters. It is cancelled because type 3 is more than 10 centimeters. So it is not the correct answer. The next option is wound less than 1 centimeters. It is also not the answer because type 3B is more than 10 centimeters. Third option is wound more than 10 centimeters. Okay, with extensive soft tissue loss and periosteal stripping and vascular bone damage. Okay, this may be the answer. The last option is open fracture, wound more than 10 centimeters. Okay, but with an arterial injury. Whenever we see vascular injury, it is always type 3C. So it is also not the answer. So the right answer to this question is option C, that is open fracture, wound more than 10 centimeters in length with extensive soft tissue loss and periosteal stripping and bone damage. Now let's move towards the other question. An overweight man, that is 90 kg, presented with complaints of not being able to squat and rest pain of left hip for 6 months duration. He had a past history of steroid and creatine use. Okay. His X-ray revealed destruction of the articular surface of femoral head with presence of subchondral cyst and positive crescent sign. Subchondral cyst and positive crescent sign. His MRI is suggestive of marrow edema. What is your diagnosis? So, the answer to this question is osteonecrosis of femoral head. So let's understand it. The complaints of hip pain in an overweight man with a history of long-term steroid use, along with the radiological findings of subchondral cyst and positive crescent sign in the femoral head. It is the characteristics of osteonecrosis of femoral head. It is a painful condition that results in diminished blood supply, mainly due to trauma or non-traumatic etiologies. The examples are alcohol, corticosteroids, immunosuppressives, and cytotoxic drugs, either singly or in combination, are the most common causes of non-traumatic osteonecrosis. The typical features are pain with movements in or near the joint, click in the joint, joint stiffness, limping gait, and deformity. Restriction of movements is also a feature of this condition. Let's move towards the other question. All of the following are associated with Sprangel's shoulder except options are diastomylia, Klippel-Feil syndrome, dextrocardia, and congenital scoliosis. The right answer to this question is dextrocardia because dextrocardia is not associated with Sprangel's shoulder. What is Sprangel's shoulder deformity? It is the congenital elevation of scapula and it is the most common congenital shoulder abnormality. All of the conditions mentioned in other options, that is diastomatomylia, Klippel-Feil syndrome, and congenital scoliosis, are all associated with Sprangel's shoulder. Let's move towards the other question, that is, a man with a POP cast of the forearm fracture is prescribed analgesics. The earliest way to check for compartment syndrome is to look for. The answer to this question is decreased response to analgesics. So the next question is, which of the following is not true about posterior cruciate ligament? The options are extrasynovial, prevent the posterior displacement of tibia, primary action is to prevent the internal rotation of knee joint, and the last option is attached to the anterolateral aspect of medial condyle. So the answer to this question is option C. That is, primary action is to prevent the internal rotation of knee joint. It is the wrong statement. Why? Because the prevention of internal rotation of knee joint is the feature, is the responsibility of lateral collateral ligament and not the posterior cruciate ligament. So the answer to this question is option C. Let's move towards the other question. A patient presented with lower limb weakness. The examiner places one hand under the patient's heels and the patient is then asked to raise his other leg against downward resistance. What is the test being performed? It is the Hooper's test. Here, it is the test which is used for differentiating between the organic and functional cause of limb weakness. Okay, we all know this test now. Okay, now let's move towards the other question. That is, March fracture is seen in the dash of second metatarsal bone. So the answer to this question is neck of metatarsal, second metatarsal bone. We have to learn it. The next question is identify the name of the instrument given below. So we all know that it is this instrument. This is the bone holding forceps. Okay. Now let's move towards the other question, that is, patient came to the casualty after a RTA with fracture of femur. On third day of admission, he developed sudden breathlessness. Which of the following is the most common cause? It is the most Common question we all know that when long bones fracture, if on the third day or after 48 hours patient develops sudden breathlessness, then it may be the cause of fat embolism. Okay, we have to mark this question. We shouldn't uh, get it wrong. Okay, let's move towards the other question. Hand knee gait in polio paralysis is due to the weakness of which muscle? Hand knee gait. So it is due to polio commonly affects quadriceps, we all know. So due to the weakness of quadriceps leads to the buckling of the knee while walking or bearing weight on the leg. So in order to walk, the patient or the person has to prevent the buckling of knee by supporting with the hand and producing a hand knee gait. So the answer to this question is quadriceps. Let's move towards the other question. The most common sequelae of traumatic dislocation of shoulder in young adults is the answer to this question is recurrent dislocation of shoulder. The next question is after a fracture, the growth of callus will be increased by which of the following? So, strict immobilization can't be the answer because immobilization restricts the growth of callus. And the opposite answer to this question is repeated tiny movements at the fracture site. So, the answer to this question is repeated tiny movements at the fracture site. Okay, let's move towards the other question. Haglund deformity is seen around which joint? We all know it is seen around ankle joint. Okay, the next question is an elderly patient slipped in the bathroom and sustained injury over the left hip. The radiograph is shown below. His attitude of the leg will be. This is the radiograph. It shows fracture neck of the femur fracture. This. So we all know that in fracture neck of the femur, the attitude of the leg will be shortened and externally rotated. Answer to this question is C. That is shortened and externally rotated. Okay. Here we finish our discussion. Thank you so much, guys, for having patience and listening me out. All the very best. For any queries, you can contact me on the email address displayed on the screen. Thank you so much.